I'm Dr. Stephen Jackshaw. I've been a dentist for 30 years. Bad breath is always a concern of patients, young and old. What's the problem, Doc? I'm brushing my teeth. I don't seem to get away from it. You know, it could be something as simple as brushing your teeth a little bit more often, but sometimes it can be a little bit more complicated. It could be as much as prescriptions that you're taking. Young or old, generally the older folks will be taking a little bit more prescriptions than the younger, but I've seen younger people take some prescriptions that really mess around with their saliva. You got to remember, a little bit of chemistry real quick. The pH, or the acidity or the alkalinity of our saliva, it goes from 0 to 14. Generally our saliva is neutral at 7. It can sometimes be a little bit more acidic, sometimes it can be a little bit more alkali. But generally it's neutral. Well, when that's ever disrupted and now it becomes a little bit more acidic or it becomes very much more alkali, we start having issues. And what can cause that? Well, prescriptions can do that. Look at this. I just grabbed a bunch of old prescriptions. These are things that patients are taking. That's an enormous amount of prescriptions. I've had some patients being taken 10 or 12 prescriptions, and one doc doesn't know what the other doc is doing. That's not to say that they're not trying. Everybody's trying to help out the patient. Most prescriptions that cause a problem from the dental aspect for bad breath are your heart medications and for your sinus medications. The decongestants. Anything that disrupts the amount of saliva flow or changes the chemistry or the pH of the saliva now starts to create bad breath. And how does that happen? Well, the chemistry in our mouth, we can affect that with foods. Of course, we eat acidic foods all day. We could eat alkali foods all day. But you know what also happens from these prescriptions? Let's look at a simple little thing right here. A little glass of water here. I just put together a bunch of prescriptions. Look what happens here. Now, if that could be happening inside your body, it can be happening inside your mouth. And that has an odor to it right now. It's not super pleasant, but when it sits in your mouth, it starts to cause problems. Now, the doctors are going to tell you to take the medications. Please do. But what can you do now to make the whole situation better? Number one, I want you to hydrate yourself a little bit more. Take a little bit more water. Keep the chemistry in your mouth a little bit more neutral with water. Aspirin has a tendency to cause some problems. It can be slightly acidic. Even mineral water is slightly alkali. But just your regular tap water is fine. Probably your bottled water would be just as good. But also get a good toothbrush. Get in there and brush your mouth, because the bacteria that's living in your mouth, again, over 1 billion bacteria sitting in there, and your saliva naturally washes them away and moves them around. But if they sit around, they're having a party and they have to go to the bathroom. So go get yourself a good toothbrush. Now, if you want to help yourself out with the bad breath aspect, get yourself the Neutralizer Plus toothbrush. It's an excellent toothbrush. You can't lose with this. But get yourself a toothbrush, get in there a little bit more often, start brushing your teeth, monitor the medications you're taking, talk to your physician, but keep your mouth clean. You'll find your breath to be better.